Hi, this is Dr. Darwin, a new dentist coach with another episode of Ask Dr. Darwin, where you ask questions about dentistry, specifically about questions about getting into dentistry, how to get in, how to apply to school, how to get into residency, which residencies to consider, especially if you're thinking about specialty programs, and then life after residency, after dental school, transitioning into the business and the practice of dentistry. Be sure if you have questions, to shoot me an email right here at newdentistcoach@gmail.com, newdentistcoach@gmail.com. Also encourage you to please subscribe to my YouTube channel, Dr. Darwin Speaks, as I will be posting videos throughout the week on Mondays, Wednesdays, Thursdays, and even on Saturdays. All right, so I don't want you guys to miss those videos. Really good information that's been helping people not only in the U.S., but also internationally as well. So today we're going to continue in our series of surviving dental residency. Surviving dental residency. This is a series where we talk to current dental residents in all different types of residencies, whether there be perio, endo, ortho, oral surgery, pros, and also GPR and AEGD. But today we have a special guest, and we salute him also for his time in the military. We have Dr. Ezra Merritt, who's just finishing up his Prosthodontics residency. So congratulations, Doc, and thanks for being on the show today.
Absolutely. Thank you for the opportunity.
Yeah, this is great, man. And so tell us a little bit about yourself.
Well, I always describe myself as an Army brat. My dad did 33 years or served 33 years in the Army as a removable prosthodontist. So I kind of had some big shoes to fill there, but he did retire when I was about 8 years old. So I was fairly young. He still moved around a decent amount. He ended up working at Howard University College of Dentistry as faculty there for about 6 years. So I actually grew up in this area, which I'm in DC right now. So in the Maryland area, and then moved to Pensacola, Florida for high school. And that's where my mom's family is from. So I actually do claim Pensacola, Florida as home. You know, that's where I spent a lot of my summers and a lot of my formative years. So Florida boy, but moved around a decent amount. Went to University of Florida for undergrad, and that was there during a pretty good time. There for the first basketball championship, and then had to watch the second one on TV and football championship and all that good stuff. So that was a pretty good time. Following undergrad, I actually did a master's of public health degree. So I did kind of a post-bac, spent a couple of years back at home at West Florida, University of West Florida, and then went into dental school at Howard University College of Dentistry. So I was there from 2008 to 2012. And I was actually there on a Navy scholarship. So I did the 4-year HPSP scholarship program, which was couldn't be beat. I mean, and I actually applied during a great time, because I think the next year they had a wait list of I don't know how many. So just kind of got in at just the right time, and it was an amazing opportunity, especially living in the DC area, to have a scholarship and that stipend. Following that, I actually did a GPR residency at Portsmouth Naval Hospital. So that was a great time to just, again, you have that foundation from dental school, to be able to kind of apply that knowledge and to build on that, following my time at Howard, which was very solid didactically, but again, getting more hands-on experience I thought was amazing. I actually had the opportunity to be mentored by 2 maxillofacial trained prosthodontists there, so I think that was kind of a big stepping stone in my direction towards prosthodontics. And following that, I did 2 years down in Gulfport, Mississippi, which was considered, what we call an operational tour. So I actually got to deploy. I was the dental dentist for a battalion of about 550 folks. So that was, again, you're it. So you have to put all that knowledge to the ground and actually provide that. And, you do have some support from specialists. So if you do have something that's a little bit advanced, a lot of times you can refer to maybe an Air Force base or another Navy dentist. And then from there, so I applied during my time in Gulfport and was accepted into the Prosthodontic program. And so I'm here in Bethesda, Maryland, and just graduated. So it's 3 years flew by. So I've been in now a total of 6 years in the Navy, and looking to stay in and make it a career, because it has been a very rewarding experience thus far. And again, I just like the fact that I'm always going to be, supported. Not stress level is manageable, when compared to as far as right now, when compared to some of the stresses of, again, running business and things like that. But so right now it's just, I'm focused on becoming a better practitioner, becoming a better prosthodontist, and it's just been a fun journey so far. So.
Wow, that's an amazing story, man. So I was going to ask you about, why did you choose Prost? But it sounds like you had some foundations based on your dad and also some mentors you had at Howard, correct?
Correct. Yeah. So my dad, I mean, even when I was young, and I don't think he was necessarily trying to push me. He's never been tried to sway me, maybe. I don't know. But he did show me some slides at a young age, I mean, literally the old school slides of some of the maxillofacial cases that he got to work, and just seeing the excitement on his face about, and the lives he changed. I think that did kind of plant a seed there. And also, at a younger age, just being in the lab, not really being interested in dentistry at that age, but just being around in that atmosphere, being in that patient care atmosphere, I think it did kind of push me in that direction. So. Right.
That makes sense. So I know it's been 3 years since you kind of went through this process, but can you briefly describe, your application process? I know it's a little bit different in the military. I also was in the military, and actually we have some similarities. When I was in the Air Force, they always kind of push you and want you to stay in. They want you to specialize, not only for helping with the mission, but also helping with your rank. That's one of the things that they encourage. But the one specialty that I thought about was Prost, because I wanted to be able to treat a quagmire of different types of cases, the more complex, both restorative and also for implants and dentures. So we kind of share that. But tell us what you remember about the application process, as far as the programs that you applied to, anything you remember about your interviews. Because I know at some military dental corps, you can apply to outside or non-military Prost programs. At least you could, several years ago. I don't know if it's changed. So kind of explain that process.
Sure. In a lot of ways, there are similarities. You still have to, get your letters of recommendation. Typically, it'll be from your program director if you did like an AGD or GPR, as well as some, mentors at whatever clinic maybe you were at, or if you're coming straight out of dental school, then obviously from professors and maybe your dean. In the military as well, if for me, I had served 3 years at that time, so you're submitting, evals, or what we call fitness reports. You still have a statement of motivation and your transcripts from dental school and maybe your board scores. I guess now a lot of it's pass fail, but so that from that perspective, it's still very similar. You're still going to do an interview. For us, it'll be with the program that you're interested in, the faculty that's there, and then they'll kind of submit this package with their recommendation to a board, and so that board will kind of look through all the packages and decide who gets what slots. So that's what we call, in-service training. So I applied directly for the Navy program at Walter Reed, so the postgraduate dental school there. Every year it changes, and it really depends on the Navy's need for in specific fields, because sometimes we're what we call undermanned, sometimes we're overmanned, and so they may open up slots for out-service training. And so at that point, you still have to apply through what we call the DUINS process, which is duty under instruction. And so that's the in-service or the military process. But if they open up a slot or two, then you can apply. You would also apply for that specific program. So if that makes sense, you still have to get accepted through the military to be able to apply. Because again, you've signed on the dotted line. You're in the Navy, and you still have to get permission, to go out service. So again, it's based on the need.
Right. So you pretty much did it in service program, meaning you did the Navy prosthodontic program at Walter Reed.
Correct. And at the time, so there was four slots, and so I was lucky enough to be one of the four to start. Yeah. So again, every year it can change as far as the applicants, the number of applicants, and how competitive it is. I know for us, from what I recall, I know endo obviously is probably one of the most competitive within the Navy.
Yeah.
And then there's some out service, like we don't have a Navy orthodontic program or pediatric dental program, so those are always out of service. And sometimes they only allow one person, a year to go to those to get selected. So it can be a long road. I mean, a lot of people, if that's what you want, they're applying a couple times, and they need to see that that's something you really want, and the second or third time they'll get it. So
right.
Yes, it's a little different. It's limited slots compared to obviously applying to programs all over the U.S. But the education is second to none. And one of the advantages, obviously, you're in the military, so you're still getting your full salary, while you're going to residency. So that's one of the biggest benefits,
Yeah, that's nice. That's nice. You're literally getting paid to learn.
Absolutely. Yeah, absolutely. And you're also still advancing in your career.
Right,
so.
Advancing your career, and you're actually getting ready to set yourself up for more pay, because as a specialist, there's a different level of pay grade, so to speak, at least how it's set up in the military. So that's good.
Absolutely. That's a big bump too. Pretty significant.
Big bump, yes. Had a question here from Facebook Live that one of the people, one of the docs, said that she had considered, joining the military, but she was concerned about, where to be stationed and how she had, if she had any control with that. Can you tell us a little bit about, now that you finished residency, how it comes up as to where you're going to be going next, and how that decision is made, and how you can be influential in that decision process, if you can or not?
Sure. It's very interesting. I think a lot of my colleagues, even in dental school, who considered the military, that was probably one of their biggest questions or concerns. Of course, at the end of the day, it's always needs of the Navy, right? So, or needs of, whatever branch or service that you're in. So unfortunately, you have some say, right? So you can say, I have a preference to live on the East Coast or West Coast, or, I'm open to going overseas. A lot of times they do take into consideration, again, I'm single, no kids. So for me, when I sit down with who we call our detailer, the detailers who decides where you're going for your next duty station, I'm kind of an open book. I said, even out of my GPR, I wouldn't mind going on a ship at this point. The CBs sound cool, which is where I ended up going. And but I'm kind of open. So for me, it's easy. Like, you put me anywhere as long as there's a golf course or something. I'm pretty easy, and you can't complain. The Navy has some amazing spots. But again, if you have a family, if you're what we call dual military, married to another military spouse, or if you have some special consideration, they really do try their best to accommodate you. Again, but at the end of the day, it is the needs of the Navy, and unfortunately, or the military, sometimes you don't get exactly where you want to go, and you kind of have to be open. And so my advice typically is, try to paint a kind of a broad swath of where you'd be open to going. If it's just like, I prefer the West Coast, typically they can accommodate that. I prefer the East Coast, but sometimes it's very hard to get specific, like, I have to go to Chicago, or I have to go down to Florida. So, when you consider the military, you have to kind of be flexible a little bit, and be open to the adventure. And that's really what it is. I'm heading to, as I told you, to Okinawa, Japan, in a couple months. And so, that was one of the things when I met with the detailer at this time. I said, hey, I'm still in a great spot. You pretty much send me anywhere. I prefer to go with the Marines. I wanted to go with just somewhere where the Marines were. I've heard they are amazing patients. I love getting the exposure to get out of the clinic from time to time and go out in the field, and do some fun things like field training. And so I knew that would give me that opportunity. So So that's a broad brush. There's several locations that I could go as a prosthodontist with the Marine Corps, and they come back, gave me 2 or 3 options, and I was able to pick an option. So again, there is some flexibility. They really do their best to accommodate you. I've been very impressed with sometimes how they are able to do that. But you always have to just prepare mentally that sometimes you may get that duty station that you may not have preferred at the time. But I'll tell you, if you keep an open mind and you just look at it as an adventure, and you know, I've loved every spot I've been at. Even when people told me, "Man, are you sure you want to do that? I heard the CVs or this and that." And I mean, so far I've been the best duty station. So
that's good.
Yeah.
That's good. Yeah, I know in the Air Force we have this thing where if you volunteer for one of the hardship, they call it a hardship tour. If you volunteer for that, they in exchange will give you a guaranteed follow-on assignment. And
it's the same for us.
Thank you. Okay, so when I was in the Air Force, the hardship was Korea,
Okay.
and a couple of other locations, and volunteering for being there at Korea for a year guaranteed me a follow-on assignment, which I took, and I was stationed at the Pentagon the year afterwards. So that was
Nice.
that was great. So good. So you've been through your 3 years of pros training, first, second, and now the third year, just finishing up. Tell us a little bit about that training. As far as what do you think was the hardest part for you over those 3 years?
Yeah, so I mean, 2 things really stick out to me. The biggest thing is just time management. I mean, and that I can't state that strongly enough that you know, it's like drinking out of a fire hose. Now that's what I was told when I first applied. So just be prepared, you know, as far as the amount of material that's kind of being thrown at you, you know, the literature seminars, you know, a lot of presentations, you know, again, because there's a minimum requirement that each program has to meet. And so a lot of classroom for us. Our program is that first 6 months is very heavily weighted towards didactics. So I mean, we're in the classroom. We're kind of brushing up, because not all of us come straight out of dental school. A lot of us have to kind of brush back up on some of those foundational knowledge.
Right.
So the first year, I would say that was probably the biggest challenge, was getting back in the classroom. You know, and just because you're in the classroom and trying to you know, the study doesn't mean that you're not, you know, you're getting a bolus of patients. So now you're treatment planning. You know, you have to sit down with faculty and treatment plan your patients. You're trying to get presentations together and things like that. So again, the time management piece was key. I think I had a pretty good handle on it.
Okay.
But moving on to the second and third year, the other piece of it was of course, from prosthodontics lab work. And that was one of the things I knew, that coming out of dental school and being at smaller clinics that didn't really have a ton of lab support, that was going to be one of those steep learning curves for me. You know, in hindsight, I wish I would have maybe sat down when I was in my GPR with some of our lab techs there, because we had a bigger clinic, to really get some hands-on with maybe some fixed work, you know, casting metal and things like that. I think that would have helped. Again, you get such a great education in residency, but it was a steep learning curve for me. So, and I kind of knew that coming into it. But yeah, it's some long hours for sure. Biggest thing is, again, most of the residents, we don't send a lot off to the lab. I mean, it's one of those, you need to know the process. You know, that's the whole concept behind it, because you're going to be running these military labs as a specialist. So when there's a breakdown in the process, you kind of need to know, okay, where in this step, you know, where in the, you know, quality assurance, you know, trying to make sure that we're giving the best product to our patients.
Right.
But also from a time perspective, because when you're sending off to the lab, a lot of times you're having to wait, you know, a month or more.
Right.
So you end up doing it all yourself.
Yeah.
So it's
I think
a challenge.
I think that's why you guys should also get that certified dental technician qualification or certification also, because you're right, it's a lot of lab work, and for many programs, you are the certified dental tech. So
right.
that would be nice to have that, designation as well. So time management, lab work were some of the hardest things that you had to kind of endure during your residency. And you mentioned this too. You said as far as things that you would do differently, one of the things maybe trying to get a little bit more exposure to doing some more hands-on lab work doing your GPR residency. Anything else that you would do differently, knowing what you know now?
For folks that are applying, I think, again, I had the benefit of having two very highly trained prosthodontists that I could shadow or be mentored by during my program. I actually had the opportunity, one of the prosthodontists actually had an injury. And so, if I had a cancellation or opening in my schedule, he would still, come to work, and I was able to deliver some cases for him and literally have him looking over my shoulder as I'm working and helping him out. So just taking advantage of some of those bigger cases, asking those questions, showing your interest, because again, I was exposed to, just because I was open to it and willing to help, I was exposed to a bit more, which again helped solidify, my decision to go into pros. I don't know, because I was trying to think, if I would have maybe tried to brush up on any, read articles and things ahead of time. I don't think that would have benefited me as much as, again, getting more hands-on experience with the lab work. And I say that because we have a couple residents now who were prior lab techs, so prior enlisted military, and they were lab techs. And I tell you, they, had such an advantage. I feel like they learned, don't get me wrong, it's not like they knew everything coming in, but they had that solid foundation, to be able to just think strategically about being, efficient in the lab. And they just had a better baseline knowledge, I think, that helped them out a lot. So
that's awesome. Awesome. So how can people contact you if they have questions, or if they are interested in either the Navy, military dentistry, or more specifically about the PROS residency? What's the best way for people to contact you?
Yeah, absolutely. So probably the best thing is to contact me on my personal email, which is emerritt, EMERITT06@gmail.com. And, I appreciate any questions. And like I said, anything about military, about my residency experience, I'm definitely happy to answer any questions.
I think I know what that 06 stands for now.
Yeah, you got it.
My uncle's one of your fraternity brothers, so.
All right.
Yeah. That's great, man. Hey, Doc, thanks so much. I appreciate your time. I know you've been busy this last month with graduating, handling family issues, and getting ready to the PCS. When's your PCS date?
I leave it towards the end of August. So okay. My movers come the last week in August. So
nice. Well, you're gonna enjoy living over in Japan. Like I said, I was stationed in Korea. Didn't get a chance to get to Japan, but where you're gonna be at, it's great, man. It's like New York. It's like DC times 10 as far as Okinawa and Tokyo and those areas over there, man. That's gonna be great.
Absolutely, I'm excited. Can't wait.
That's great, man. Well, again, thanks so much for your time today. And if you guys out there, if you can't wait to hear an answer back, or if you have a question and you're waiting to get the answer, hey, be sure to contact me here at newdentistcoach@gmail.com. Also, if you're interested in coaching one-on-one and becoming one of my mentees, we also provide that service for you all. Again, just send me an email at this email address, newdentistcoach@gmail.com. In the subject line, put in "Coach Me." All right. Hey, Dr. Merritt, Officer Merritt. What's your rank now? You're major?
Lieutenant Commander. Yeah. So same equivalent, but Lieutenant Commander.
Lieutenant Commander. Hey, Lieutenant Commander Dr. Merritt. Love it. Hey, man, thanks so much. We're going to be following your progress as you transition out of residency and now into the life the continuation of your military career, but now as a prosthodontist. Thanks so much, man, and safe travels to Japan.
Absolutely, thank you.
You're welcome. You're welcome.